Therefore, I had to train myself in clinical examination, especially palpation of muscles, to better understand the injuries. For medical history, a careful clinical examination of the injured area with inspection, palpation, comparison to the contralateral side, and functional testing of the muscles is crucial in the diagnosis of muscle injury. Palpation gives the examining physician an impression of the affected muscles in comparison to the muscles on the non-injured contralateral side. Palpating a muscle provides the tone, the temperature, the condition of the muscle, and possible adhesions, scarrings, and so on, which is essential for the diagnosis. These are qualities that imaging never can provide. Palpation reveals if there is any pressure pain and whether the pain is localized or whether it covers a large area. It also helps to detect if the muscle is edematous, whether there is pain or relief on careful stretching, and if there is a palpable defect. Hand and fingers slide several times over the muscles, getting an impression of the muscle tone and searching for a muscle area that has a higher tone than the adjacent muscle. Usually a tear can be found within a firm muscle band. Palpation is performed with moderate pressure and movements. The fingers should repeatedly slide on the muscle from proximal to distal and back, as well as across the fibers, and should not press only the muscle down. In the early 90s, after I had some training in palpation since about 15 years, I made the following experience. I palpated in a particular type of functional injuries, a thin accompanying edema in the periphery of the injured muscle cord, which is hypertoned all over its total length. Edema was not found in other types of functional injuries. Signs of inflammation, crepitation, or hematoma could not be found. I realized that lumbar problems such as disc bulging, degenerative changes, or only blocked joints in the lumbar spine or blocked SIG can have a decisive influence on the muscle tone regulation and play therefore a crucial role in case of muscle tightness due to an irritation of the motor nerves. We see quite often that athletes have not realized their lumbar problems because they do not feel pain in the lumbar spine. Regulation of the lymphatic system and the subsequent muscle edema is thinkable since the regulating vegetative nerve fibers that accompany the motoric nerve are also affected. Today we name this particular functional muscle problem spine-related neuromuscular disorder. It could be argued that this presents mainly a back problem with a secondary muscle disorder. However, this secondary muscle disorder can prevent a player from training in competition and will require comprehensive treatment that addresses the primary lumbar problem as well, facilitating the athlete return to sport. A differentiation of these disorders from others is important, not only because of the different pathogenesis, but more important because of different therapeutic implications, which means that we have to treat the lumbar and the iliosacral problems. After an infiltration treatment of the lumbar spine, quite often a spontaneous tonus decrease in the corresponding firm muscle can be observed. In case of a spine-related muscle tightness, the athlete feels a spontaneous relief. I have tried to explain these findings in presentations and publications since the early 90s, but it took time until the content has been understood. In the late 90s and beginning of the 21st century, more and more research was done on muscles. Many famous researchers did fantastic studies on muscle biology, biomechanics, regeneration, and preventive strategies. Recurrences were and are still frequent. The literature says that the recurrence rate for hamstring injuries in sports is up to 30%. I made muscle injuries to my main interest. I trained myself more and more in clinical examination, especially palpation, which was not taught during the years of residency when becoming specialized in the field of orthopedics and sport medicine. To regulate the muscle tone by preventing a reactive increase in tone or by relieving muscle firmness that is already present, and to create optimum conditions for muscle regeneration. In case of a functional disorder, a specific treatment pathway has to be chosen. A spine-related problem will be only solved with a specific treatment on the lumbar spine. That means specific physiotherapy, core exercises, infiltration treatments. On the other side, a fatigue-induced muscle problem could be easily treated by break and massage. I have changed my therapeutic approach only marginally since the 70s, since it has been proven highly effective. It is necessary that the therapist is able to localize the injury by palpation to set the infiltration needles precisely. Since the 70s, I use activigene together with Traumel in the treatment of muscle injuries. Activigene is a deproteinized hemoderivat obtained by ultrafiltration of calf blood. It is constituted mostly of electrolytes, essential trace elements, a mixture of amino acids, and intermediary products of carbohydrates. I know that there is still controversy about its biologic actions, especially in muscle tissue. But I'm still convinced that activigene is the most helpful and highly effective medicine in our treatment. The daily experience with athletic muscle injuries, some of them were treated not successfully elsewhere, supports this. In over 36 years, I have never experienced any side effects. No complication occurred. The first insight in the mode of action were that activigene promotes an insulin-like activity of the local cellular energy metabolism through a better supply of muscle cells with glucose. That means that activigene improves the uptake and the utilization of glucose. Besides this, it improves the blood circulation. That was the reason for me to use it in order to improve and accelerate the healing of muscle injuries. Autologous serum products have lately become a focus of growing interest in the treatment of muscle and tendon injuries. PRP is increasingly used in situations that require rapid return to play, and more team doctors report subjective data of positive effects in muscle injuries. However, I doubt that PRP will help to improve muscle healing. In contrary, it can lead to formation of scar tissue due to its effect on fibroblasts. Adequate physical therapy methods have an important role. Continuous and intensive physical therapy as early as possible, rehabilitative exercises, and training therapy are essential components in the reconditioning of an injured structure. In athletes with more severe muscle injuries, it is particularly important to conduct regular clinical examinations to evaluate the progress of healing. With the best possible treatment and discipline of the injured person, the absence time in a functional muscle injury is less than a week, in a minor partial muscle tear 10 to 14 days, in a moderate partial muscle tear approximately 6 weeks, and in a severe tear up to 12 weeks. Our textbook for sports medicine which is finally available in English now, has already attracted considerable interest. Thank you for your attention.